In this presentation, we will be discussing the pharmacology of the drug Versed. The generic name for the drug is midazolam. This drug falls into the category of drugs labeled as benzodiazepines because they all have a 7-ring structure. You often hear this category referred to as benzos. The following slides will lay out the popular concentrations, mechanism of actions, effects on various tissues, side effects, and the use of the drug in modern-day anesthesia. Midazolam comes in several different concentrations. The most popular seen in today's world of anesthesia is 2 mg per milliliter or 5 mg per milliliter. Midazolam is more water-soluble than other diazepines, which are often emulsified with propylene glycol. This is a unique property reduces the irritation in the vasculature when compared to other benzodiazepine counterparts. The drug midazolam is categorized as an allosteric modulator of the gamma-aminobutyric acid type A subunit, or GABA-A receptor. From here on out, I'm going to refer to it only as GABA receptor. The GABA receptors are located throughout the brain in an uneven manner. However, most of them are located in the limbic system, cortex, and cerebral cortex. Because midazolam is only an allosteric modulator, you still need endogenous GABA in order to have any effects. Midazolam enhances inhibitory neurotransmission by modulating the activity of the GABA receptor in postsynaptic membranes. The binding of the drug increases the affinity for the neurotransmitter GABA on the receptor and increases the length or duration that the channel is open. Once GABA binds to the receptor, the previously closed chloride channels are now open. Chloride ions are negatively charged. Therefore, when they come into the cell, they hyperpolarize the cell. This increases the threshold for depolarization by any type of stimulus. Sedation, anterior grade amnesia, and anxiolysis is the result. This is an animation of how midazolam works at the GABA receptor. The GABA receptor is 2 long green rectangles. The purple circle is midazolam, and it's going to attach at the GABA-A type subunit, and that increases the affinity for the dark green circle, which is our GABA neurotransmitter. So it's going to come down, and it's also going to attach to the GABA receptor. Once it does that, the light green circles, which is the chloride ions, are all negatively charged, are going to come into the cell. And what the midazolam ultimately does is it increases the affinity for the GABA neurotransmitter to bind, and then leaves that channel open longer so more chloride can get in. And it all results in hyperpolarization. Due to the wide use of this drug and several different indications, the dosing varies according to its use. The dosing for intubation ranges from 0.3 to 0.3 mg per kilogram. Maintenance dose ranges from 0.03 to 0.2 mg per kilogram per hour. An anxiolysis dose ranges from 0.025 to 0.1 mg per kilogram. And if the procedure warrants an oral dose, then the dose ranges from 20 to 40 milligrams. The IM dose is 0.05 to 0.2 milligrams per kilogram. The onset of midazolam varies in accordance with this administration. The IV onset of the drug is in the range of 30 to 60 seconds, peaking in 3 to 5 minutes. Peak action of the IM administration ranges from 15 to 30 minutes. The fast onset can be explained by its 7-member ring. Midazolam is water-soluble at a low pH because the imidazole ring is open. The ring closes at physiologic pH, while the drug is more lipid-soluble. Duration of the drug midazolam also varies with this administration. Midazolam is shorter acting than the benzodiazepines because of the high hepatic extraction ratio. This makes it favorable in anesthesia. The IV administration has a T1/2 alpha, or clinical duration, of 15 to 18 minutes. The T1/2 beta, or elimination half-life, is 1.5 to 3.5 hours. The duration of IM administration is the same as the IV, ranging from 15 to 80 minutes. The PO administration of the drug gives a clinical duration of 2 to 6 hours. Midazolam is eliminated by hepatic hydroxylation of the methyl group in the imidazole ring, which only decreases but doesn't eliminate all the pharmacological activity. This is also known as a phase 1 metabolism. The drug is dependent on the cytochrome P450 3A4 pathway. Therefore, any inhibition of this pathway will increase the duration of the drug's activity on the body. Also, if you induce these enzymes, you will need more drug to get an effect. The drug is then excreted by the renal system in the urine. The presence of renal failure may lead to a prolonged activity of the hydroxylated form of the drug. The indication of midazolam ranges from full induction to anesthesiologist and premedication. Other uses include anticonvulsants, sedation for critical care patients, alcohol detoxification, skeletal muscle relaxation stemming from the spinal cord, and acute insomnia. It is widely used for its rapid onset and its potency when compared to other drugs in the benzodiazepine class. It is also more water-soluble and doesn't need to be emulsified in propylene glycol, which reduces its venous irritation when administered IV. With short-term administration, it has relatively rapid emergence due to its redistribution in the body. Midazolam has very few absolute contraindications. Pregnancy and breastfeeding mother are one of them. It is a pregnancy category D. It has a potential to depress the fetus if given prior to birth. It also may cause birth defects early on in pregnancy. Neonates should not receive rapid IV injections due to the risk of severe hypotension and seizures. There is a dose-dependent respiratory depression when midazolam is combined with other opioids. This is especially pronounced when a patient has chronic obstructive pulmonary disease or sleep apnea due to the blunting of the hypoxic drive. In a hypertensive cardiac patient, they can become even more hypotensive because of vasodilatory properties. Caution should be taken with patients that have ischemic or valvular heart disease, and also with renal failure because of accumulation of the conjugated metabolites and a delayed elimination. Benzodiazepines are associated with increased risk of postoperative delirium in the geriatric patient population. The following is a couple links to find additional information on midazolam. The following are great resources that have an abundance of information about midazolam. Thank you for listening to my presentation.